I will touch on 3 topics today. One is a reset of our healthcare protocols. Second, changes to the home recovery program. And lastly, an expansion of our booster program. Let me start with the first on healthcare protocols. Last week, I said that MOH is taking a holistic relook at our healthcare protocols, meaning what to do if you are tested positive, what to do if you are close contact or live with somebody who has been tested positive. So all the protocols we see today, they were developed over the past 20 months, mostly during a time when we were trying to eradicate the virus from our borders. But now we are in a very different situation. And these protocols need to be updated for the following reasons. First, it has become confusing and frustrating for most people. If you live with someone at home who came down with COVID-19, you are quarantined, you can't go out, you can't work, students can't take their exams. And once on quarantine, you need a PCR at the start and at the end. And at the end, you have to take public transport to a testing center. Sometimes there's a long queue. And that also added to the anxiety of people. And some preschool centers, for example, or companies, if there is a infected case, it may close down, further disrupting lives of many people. So some people tell me they are more afraid of these rules than COVID-19 itself. And this is a sentiment and a problem that need to be addressed. Second, the characteristic of the Delta variant and vaccinations have changed our risk calculation. With the Delta variant, viral loads tend to be higher than previous variants and rise up very fast. And that is one reason why the Delta variant is a lot more infectious. But there is a slight benefit to that because with higher viral loads, ART, including a self-swab, does a pretty good job at detecting someone who has been infected and is infectious. And that makes ART more useful now than before in terms of detecting COVID-19 patients. Third reason is that given ART is more useful now, there is a potential for us to replace 10-day quarantine for close contacts with a test protocol. Let me share some figures. Currently, about 10% of people under quarantine due to close contacts become infected. Out of that 10%, 8 percentage points are tested positive at the point of starting their quarantine, and 2% tested positive during their quarantine. Given this, a test at the beginning will catch the majority of close contacts who are already positive. And then repeated ART tests can detect most of the rest and the tail risk. A system like that is less watertight than today's quarantine system, but it can significantly and substantively manage the risk. And we also need to take into account that as we move towards living with COVID-19, if we restrict large numbers of people every day over prolonged periods to weed out the last tail risk, it is actually not sustainable and, in fact, very frustrating and disruptive to many people and families. So with these considerations in mind, we have reset all our testing and isolation procedures into a simple, what we call the 1, 2, 3 protocols. Because there are only 3 procedures from henceforth. And these 3 are like 3 lines of source codes or 3 building blocks that can cater, we believe, to almost all situations and circumstances. And they are as follows. Protocol 1 is when you are unwell and you have been tested positive. For example, you fell sick, you see a doctor prescribe a test, and you turn out positive. what do? You are then required to stay home, isolate yourself, and MOH will contact you on your recovery, whether through the home recovery program or be brought to a healthcare facility. And if you are vaccinated, you will be discharged in 10 days. If not, 14 days. There is no more day 6 PCR swab and discharge. There is no more day 6 PCR swab for early discharge. Discharge will then purely be time-based. So when the time is up, the alert in your trace together will be automatically lifted. Protocol 2, you are well, no symptoms, but tested positive. This usually happens when you participate in your company's or your employer's routine testing operations, and then you test yourself positive. What do? This is an existing protocol that has been published repeatedly in the papers. So what you do is isolate yourself for 72 hours or 3 days, and thereafter test negative for ART to exit isolation. And if your conditions worsens, see a doctor, and the doctor will test you and look at you and see if you have been infected. And if yes, follow protocol 1. Final one, protocol 3, you have received a text from MOH that you are a close contact. Could be a colleague, could be a family member. You use the notification to withdraw ART test kits at the vending machine, and then you follow a 7-day procedure. First day, you are required by law to test yourself with an ART kit and then upload the results. After that, test negative before you go out on the same day. On day 7, test yourself for the last time and then exit the procedure. Anytime you don't feel well, go see a doctor. And if positive, refer to protocol 1. Anytime your ART test turns out positive, refer to protocol 2. So with this, that is all. With this, we effectively merge quarantine, healthcare warnings, healthcare alert into one test procedure. And we have effectively replaced lengthy quarantine period with a testing procedure that allows for flexibility without compromising public health. The new procedure will be effective next Monday, 11th of October. I want to also urge various companies, employers, regulatory agencies to try to align existing practices to these protocols. I understand for many sectors and many employers, the concern about risk is higher, and there is a need, they feel, to impose additional measures at the industry or at the company level. We fully understand that. So, for example, a higher tempo of routine testing based on ART tests, that's fully understandable. MOH, we ourselves do that in our hospitals. But we should refrain from imposing PCR swabs purely for surveillance of our employees who are not even displaying any symptoms. As for those already in the system and following current procedures, we will need to make some transitional arrangements for you. So if you are currently a COVID-19 patient, you will serve out the 10-day isolation if you are vaccinated or aged below 12, or 14-day isolation if you are not vaccinated. If you are currently a close contact and on the quarantine order, you will no longer need a PCR test. If you test yourself with an ART kit and the result is negative, you may go about your normal activities for the day. Do so until day 7 in accordance with Protocol 3. To provide more support for regular self-testing at home, MOH will be conducting another round of distribution of ART kits, and this will last from 22nd October to 7 December 2021. This will be done via sync post, and each household will receive a package containing 10 ART self-test kits. And this is a significant change, and a pivot in our strategy. All the complicated rules frustrates people, and are a constant reminder to people that COVID-19 is a scary disease. In fact, the vast majority of people who are infected exhibit mild symptoms or no symptoms. More than 98% mild symptoms or no symptoms. And our data shows clearly that the risk falls mainly on two groups: those not vaccinated and age 60 and above, and all those age 80 and above. If we recognize this and then change the protocols, I believe we can lift the fear and confusion surrounding COVID-19. And we can all exercise personal responsibility and do our part to overcome the pandemic. And then focus our efforts on the two vulnerable groups I mentioned earlier. We now have a simple set of rules that we believe is effective and easy to understand. And I'm sure there will be an initial period of getting used to, but I'm confident that things will then settle down and everyone will find that this is much easier to follow. We have been talking about total defense, and that the most important aspect is psychological defense. The reset of rules addresses the psychological state of our society as we overcome this pandemic.